Welcome to my podcast. Today I'm going to talk about another case that can be included in the differential. So basically, after you introduce yourself, as always we agreed, double check the patient name, date of birth. The patient might say, "Oh, doctor, I'm having something that it's concerning me since some time. It's my private area that I have like a sore thing, or I have a bulge, or maybe an ulcer, which is not causing any issue, but it's just there and it's not going away." So you need to talk to the patient and ask, can you tell me more about it? Do you have any specific concern? Have you had any partner in the last 3 to 6 months? Any recent partner? How's your sexual life, if you are sexually active? And do you have a stable partner? Have you traveled abroad recently? And do you have any discharge? What sort of safe sex do you follow? So all of that kind of thing that you need to ask, especially if the patient is young, teenage, or sexually active group of patient. So it could be like, as I say, a red spot or a sore thing, or it could be just an ulcer, which is painless probably. So in that essence, you need to think about anything that's related to sexually transmitted infection. And one of the things that you could think of is syphilis. So it has been stated that syphilis, it's on the rise recently in the UK, and in 2022, record shown highest level, which soaring from 8,700 since 1948. And as we know, it's sexual transmitted infection, and it's carried by a bacterium called Tryptonema pallidum. And if it's untreated, it's easily treatable. However, if it's not treated, it can cause a reversible long-term health effect. And therefore, always we have to put it as a differential and take it from there. It has been suggested also, apart from the common symptom that we know, it could affect the eye. So it can cause a lot of eye issue. And you need to just consider it in any red, painful eye. It has been stated that 75% of the syphilis cases were found in men-to-men intercourse, also can be seen in heterosexual contact, whereby they can catch the microorganism. However, the good news, it's easily treatable once suspected and tested, and the treatment of choice is basically penicillin. The patients can be advised to order a self-kit for testing from the pharmacy. And as I say, symptoms can be tricky and hard to note. However, the commonest is basically painless sore or ulcer in the genital or in the mouth, or rash, which is grayish or warty lesion in the palm and the soles. Even the patient might present with flu-like symptoms sometimes, can have generalized swollen glands all over the body, or patchy hair loss. On that condition, you could think of alopecia areata. But however, in the syphilis is called moth-eaten hair loss, and it's characteristic. However, for the eye, it can take different forms, like, for instance, uveitis, which is inflammation of the iris and the ciliary body and the choroid, or which can be put under the differential of red painful eye. Also, it can affect chorioretinitis, which is causing inflammation of the retina and the choroid. Also, it can affect the optic nerve and cause inflammation, which is called optic neuritis. And the other thing is conjunctivitis, which can be in the form of itchy red eye with discharge. The main treatment of choice is penicillin. However, prevention is very important, so I always advise the patient, if it has been suspected with syphilis, that they need to refrain from sex for the time being treated. Also to use condom always, wherever, whatever sex practice they are performing, whether it's oral or genital, which I mean by that, vagina, or of course some people they use anus. So in that regard, you have to use a condom in every act of sex, and also advice about not using sex toys. And if they use this kind of thing, they need to wash it and apply condom whenever they're gonna use it. And also avoid sharing needles and try just to be using the non-safe sex practice. So by this, I have covered one of the cases which seems to be on the rise nowadays in the UK and can be considered as differential whenever there is an issue in regard of sexual transmitted infection. Thank you.